Okay, everyone, we're going to get started. Thank you for joining us. In case you don't know what webinar you're at, you're at the webinar TCM for Diabetes here at Five Branches University with Professor Julie Zhu. Really quick, just a reminder, this Saturday, March 19th, we're going to be having an event at our San Jose campus called Experience Studying Traditional Chinese Medicine. So basically what you do is you come and you join us this Saturday and you get to learn what it's like to be a student here at Five Branches University. We're going to hold an acupuncture treatment and diagnosis. You get to see a student panel, which means you get to hear what our students have to say about us, and you get to learn about our new program, which is a first professional doctorate program, which means at the end you get both a doctor and master of traditional Chinese medicine degree. And I just want to thank you all for joining us so much, and we'll go ahead and get started. So, good evening, everyone. Thanks for joining in. Welcome to the webinar TCM for Diabetes with Professor Julie Zhu. Today, we will have a little introduction by myself and the webinar series, and then we'll have an introduction also about the professor, and then we'll begin the lecture TCM for Diabetes. So, a little bit about Julie Zhu. She's a graduate of Shanghai University of Traditional Chinese Medicine and Pharmacology. So she has nearly 30 years of experience treating a variety of diseases with acupuncture and Chinese herbs, and she specializes in women's health and pain management. So just for everyone's knowledge, this is the 6th webinar of our TCM webinar series. In this series, we look into how TCM can help many of the diseases that Americans face today. So please join us to learn more. Our next webinar will be in April, and that is TCM for Dermatology. And after that, in May, we will have a very interesting webinar, TCM for Cancer Therapy. So just a little information about our webinar. Our webinars go from 5 to 6 p.m. and the agenda is basically me introducing the webinar and the professor, and then the professor giving her lecture. And after the lecture, we'll have a short poll, and then you can ask the professor any questions you may have. And really quick, just to remind you, any questions you have for the professor in the lecture, please ask them in the GoToWebinar pop-up in the questions portion, and we'll get them to the professor for you. All right, thank you so much for joining. Here's Professor Julie Zhu, and we hope you enjoy it.
Kasa. Hello, good evening, everybody. I'm Dr. Zhu. Actually, discussing today, we are discussing the topic is diabetes. What's the diabetes? I think everybody knows what's diabetes. The diabetes now is the very common disease in this world. Actually, diabetes, we can just divide type 1 and type 2. Okay. It's okay, huh? As everybody knows, the diabetes, type 1 diabetes, is the almost, I think, young kids' diabetes. It is usually diagnosed in the children and the young adults. Only have the 5% of the people with diabetes have this form of this disease. In type 1 diabetes, this is because the body does not produce the insulin. And the body breaks down the sugar and the starch. You eat into a simple sugar called glucose, which it used for energy. Insulin is a hormone that the body needs to get glucose from the bloodstream into the cells of the body. With the help of the insulin therapy and other treatment, even young children can learn to manage their condition and live longer and healthy lives. This is we discussed in the diabetes type 1. But most time we treatment use the TCM, the type 2 diabetes. It's more successful. Okay, type 2 diabetes. This is because the problem with your body that cause blood glucose level to rise higher, okay, than normal. Yeah, this is also we called hyperglycemia. Type 2 diabetes is the most common form of the diabetes. If you have the type 2 diabetes, as your body does not use insulin properly, this is called insulin resistance. As the first, your pancreas makes extra insulin to make up for it. But over time, it isn't able to keep up and can't. But it can't forever. What's that? Yeah, the forever to make the enough insulin to keep your blood glucose at normal levels. So this is the diabetes, the very simple, generally introducing. Okay, from the TCM. So actually from the TCM, we treated the diabetes a long time already, almost 1,000 of the year. Okay, from TCM, we always discussing the diabetes has the principle, pathogenesis of the yin deficiency. What means the yin deficiency? The yin deficiency, that means the body have the internal heat. The more heat inside, the damage the yin deficiency. Actually, that diabetes is attributed to the yin deficiency and proper diet. Proper diet, that means eat something wrong, eat too much the sugar, too much the protein, too much the fat. Okay, and sometimes the patients have very emotional disorder. The emotional disorder will relate to the liver. So liver, for the body is very important, involve the digestion. If some people live very stressful and emotional and anxiety, they affected spleen, make spleen weaker, so make digestion just like lower. It's just another I think the causes. And the other is overstrain. That means with overstrain, people work so hard, even the physical and psychological. It's work so hard. They always damaged some related the liver and the spleen and the kidney. So this is another reason. Other reason is excessive exhaust activity. This also damages the kidney. It's damaging kidney. This means with the kidneys, your whole life, the immune system is for the body. So if a kidney deficiency, we also consider the yin deficiency and the excess deficiency and the qi deficiency, even the yang deficiency. So this come from the body. So from the TCM, we consider the diabetes always damaged. They related lung and the stomach and the kidney. Yeah, they related the lung. Actually, the lung is the major organ in up jaw. We call it the TCM, we call up jaw. That manifests as the patients always, very thirsty, very dry mouth, and they want to drink lots of water. And if drink lots of water, they still feel very thirsty. So that means we call the lung yin deficiency. Lots the internal heat in the lung. So the people is always feel thirsty and the dry mouth. That's what we can discuss in the lung. Lung is the very important organs involved diabetes. Other is stomach. Stomach, as everybody know. So we consider stomach is mid-jaw. Mid-jaw, that means they involve lots of the digestion. They with the liver and the spleen and gallbladder. So if you eat something like too much the sugars or too much the fats, too much the protein, they always make internal heat in the stomach. So this means what the patients always want to eat. Always wants to eat. They always hungry. They always just eat some food. So that means the patient does not use the insulin properly because too over. So we also consider this when the heat in the stomach, when the food is not distributed lung, the stomach and the kidney were suffering from the secondary yin deficiency. As the secondary yin deficiency, we used to consider from the lung and this means from the stomach, we also talk about very lots of heat in the stomach. So make the people want to eat all the time. Then they affect the kidney. The kidney is the root of the diabetes. The kidney we know there's the root of the diabetes. And the kidney, this same like the parents give to enough the energy inside and essence inside and the blood inside and the qi inside. So they're very normal to digest the TCM we consider they involved to the urination. So the people, if they have diabetes, they always frequently went to the urine and with the urine have the tubate inside. That we consider because the kidney have the something deficiency inside. And also kidney yin is the foundation that supplies the fluid for the internal body. Once the kidney yin deficiency, lung and stomach yin will be not have their source and eventually become deficiency too. So diabetes, we always consider the three organs is very important for this disease: lung, stomach, and the kidney. It's okay? Okay. Okay, the main pathogenesis lying in, we always consumption of the yin food leads to the endogenous dryness and dryness heat in the body. The dryness heat in the body, that means that the body have no enough the water. So with yin deficiency as the principal aspect and the dryness heat as the secondary aspect. And often with the presence of the blood stasis and the phlegm retention. That means that the patients, if you have the diabetes, the blood sugar very high, and make the blood is very thick and thinner. So this means make blood circulation more slowly. Okay, this another is we think the diabetes, they have the pathogenesis lying in the yin deficiency and blood stasis, the phlegm retention. So phlegm retention that's in the blood very just sticky, and hard to make the circulation so slower. So lots of something happened. For example, lots of people, if they have diabetes, they have the easy heart attack and the stroke because the blood thinner, blood very sticky. If the patients have diabetes, they prolong the yin deficiency, impair the yang. So that means yang. Yang is in the body we consider because the energy. This will result in the deficiency of both yin and the yang, as well as the deficiency of both qi and the yin. So from the TCM, we always consider blood have the qi and the blood. This is the both very important material in your body. Another is the yin and the yang. From the TCM also, we always discuss yin and the yang. Yin is your body fluid. Yang is your body energy. If they lost the balance, okay, something happened. For like diabetes, for the people can digestion very well, that will happen. Okay. Okay. This we continue discussing, and the diabetes, the symptoms. What's the symptoms, and for diabetes? This we know. Often there has no symptoms in the beginning, earlier stage. They just like patients who say, "Oh, I have very good appetite. I eat very well. I like to eat," but sometimes maybe you can just like if you eat too much, you're always hungry. You always just want to eat. Okay, this you can, I think about this. Maybe you have the pre-diabetes, or maybe just like borderline diabetes. Yes, often, but sometimes no symptoms at the early stage, just normal. If the patient has symptoms of always being thirsty, the thirsty means if we drink lots of cold water, it's hot water, you're still thirsty. And this means the signs you have the diabetes. Another is hungry. The people always hungry, always want to eat, always maybe eat lunch at 12 o'clock, but after 1 o'clock, I find my hungry again. That means, You think this you will have the diabetes, something wrong inside. Other is the patient's frequent urination. The frequent urination, just like we always relate the kidney with kidney qi. You suck your urination. They're holding urination. If the kidney qi deficiency, so the people is going to the urines very often, and very just like long and very clear. That means what? The patients have the diabetes. Some people go to urination one day, most 5 times, especially in night time. They have the often 3 times, 4 times at night. This is abnormal. The patients, they were concerned you have something wrong inside. The most we consider diabetes. Okay, that's if the patients, even the patients, they eat a lot, they drink a lot, they still feel very tight, very tightness. This is another symptoms. If young people, they always feel very tight. When you wake up, still feels tight. Okay. Actually, young people, they have lots of energy. If people have very tightness, that means you have the diabetes. Other symptoms, just like patients, even eat a lot, even drink a lot, they still lost lots of weight. It's other words. Some people, diabetes, they lost lots of weight. It's no very good. Okay, and as the late stage, the people always feels some like very itch in the body, and the skin very itch, and some people is numbness, or some people the blue vision, they see no very clear, and the skin numbness, and especially in the toes numbness. So we also consider some people have the diabetes. Okay, this diabetes can be found at any age, but young age, some start very carefully because the type 1, but it's more income in middle age and older people. It's the middle age and the older people. Okay. From the TCM, the diabetes we consider, we discussed already, huh? And the theory diabetes, we always consider yin deficiency. Yin deficiency include what's the lung, stomach, and the kidney. Another is because the lung related, the spleen, and the related stomach, and the related kidney. So this means lung also involved, metabolism and the urination. Okay, the lung is very important for in the TCM. They will send the qi going to the downwards. So some people urination too much because we consider the lung is the weaker. Weaker, that means they have the yin deficiency or qi deficiency. They're related. This is the lung. And the improper diet. What's mean improper diet? People eat too much of the sugar, too much of the sweet food, and they will relate the diabetes, too much of the sugar, retention in the body, so the diabetes will happen. Okay, that's one is. Another is the people get older, the endocrine and the insulin is not enough to strong digestion the sugar, so also they make the diabetes. Okay. Other words, the emotional disorder. Emotional disorder, that means the patients, for example, too much worry, too much stress, too much the anxiety, too much the work so hard from the work, or some, they will also affect the digestion. If the patients this time eat too much the sugar, like chocolate, like some like candy or some like the some candy and like crack and the dessert. They make the stress lay down, but eat too much the sugars also. This from the TCM we consider they will relate to the diabetes. And overstrain, we discussed already. Overstrain just some people is very just like labor. They work so hard. They use the body so long work, so they will make the diabetes. It's too much the work, and the excessive the extra activity. This is the most we consider men. The middle-aged men, they always work so hard, and they will support family. So if this time too much the sexual activity, they always make kidney deficiency. Kidney deficiency, as we said, kidney deficiency most time, if the deficiency, they hard to, make urination frequency. So people is always go bathroom often. So they lost lots of water in the body, and they make the kidney yin deficiency. Okay, 还有什么？You want the treatment?
What? She went through them all already.
差不多吧？啊，half hour?
We just didn't touch on.
You want the treatment?
This one, you didn't touch on that?
Oh, yeah, okay. Okay, diabetes in the TCM, we classification. Okay, but and I think there's lots of people at the beginning they find didn't, because the beginning they have no just like symptoms. When they find maybe the patients get long time already, so they insufficient yin fails to the support function of yang. That means was that they lost the balance, yin and the yang balance. Okay, so this a result, the yang become deficiency, and the deficiency of the both yin and the yang. So most we consider if the imbalance of the yin and the yang, lots of issues happened, and more complicated, very complicated, involved multiple organ symptoms. So diabetes, multiple organ symptoms like lung, okay, stomach, and the liver, and the spleen, and the kidney. This organ, there's a zang organ, we call zang organ involved. The TCM, we have the zang and the fu. Zang is include the lung, okay, liver, spleen, and heart and the kidney. Fu organ we involved like large intestine, small intestine, and bladder, and the gallbladder, and we call this also involved the sanjiao. Sanjiao does means we discussing before, and the up jaw and the middle jaw and the low jaw. The three jaw, this is like a brutal. They involved digestion and involved urination. So the make people is, I think this is for very simple we discussing the diabetes, and the treatment for diabetes from the TCM, we use the needle and we use the herbs. The needling is actually with the acupuncture point. We put this channel for the lung channel and the spleen channel and the stomach channel and the kidney channel. This put in this channel, we adjusted yin and yang. We can reduce the heat from the lung. We have the stronger stomach and help your digestion. We nourish the kidney, yin and yang. We make balance. So this we have lots of points. For example, we have the lung 7 and the lung 5 and the lots of points. Maybe after you learn, you know this. And the formula, we have lots of formula actually for diabetes. For the formulas, we have 消克丸 and 六味地黄丸 and some, lots. Actually, most the herbs we used very well. For example, like 黄芪、天花粉 and 白术, some lots of herbs. It's very good for diabetes. The time? It's okay?
Great. Yeah, perfect.
Okay. Okay. You have a question?
All right, everyone, really quick, we're just going to have you guys participate in a poll. Once again, if you have any questions for the professor, please feel free to ask in the questions portion of the GoToMeeting pop-up, GoToWebinar pop-up on the side of your screen.
It's a question.
All right. The first question, Professor, comes from Julie. And can TCM help heal diabetes if the patient has been using insulin for many years?
Actually, the TCM, the herbs and the acupuncture, we can reduce the problem from diabetes. And some people, for example, they eat too much. We can use the needle, less you eat. And some people have the neuropathy or some pain. We can reduce the stimulation of the point. We can less pain. And
so her question is, can TCM help heal diabetes if the patient has been on insulin for many years?
Many years. How many years?
Judy, if you're listening, how many years has the patient been on insulin?
About 6 to 7 years.
About 6 to 7 years.
Oh, 6 and 7 years.
Yeah.
But you're diagnosed by doctors type 1 and type B, type 2.
Judy, if you're listening, is it type 1 or type 2 diabetes?
Type 2.
Type 2.
Oh, type 2.
So she's been on insulin for 6 or 7 years with type 2 diabetes.
But most time with the type 2, we don't use the insulin. What's going on? I need you to tell some information.
What's your suggestion?
Yeah, just what's your suggestion?
Oh, my suggestion maybe, this I think is why I use the insulin. Sometimes type 2 we don't use the insulin, but you also the diabetes only 6 or 7 years. It's not longer, right? It's not that longer. But how it is? I can ask you a question. How old is you?
So ask Judy, how old are you, if you don't mind us asking? While she's answering, there was another question. What are the actual meds? What are the actual meds, herbs for diabetes? Peter is asking.
Just herbs.
Yeah.
We have lots the herbs, but what kind of? Most time we just we support the qi, so we use 黄芪. Another is we use the 天花粉黄芪, and And some herbs we just like so and actually we have lots of herbs. Depend on what's the symptoms. So basic the formula we use the 六味地黄丸, but we take off the sodi. Sodi more just, I think is the sweet.
Oh, okay. So Peter says he has type 2 diabetes
Mm.
for 25 years.
Oh,
and
25.
He's
Wow.
taking metformin
Uh-huh.
and Januvia.
Uh-huh. It's good.
So I
yeah.
guess he's asking
So-
what kind of herbs would help for that.
Yeah, the herbs support you. I think you have the symptoms of very dry mouth, right? They support you, make you more moisten and more saliva in the mouth.
Yeah, he says
Yes.
he has dry mouth.
Yeah, very dry mouth. Some herbs like we have the 麦门冬, okay, 天门冬, and the 微子, and the 远志. The most make you more saliva inside.
Oh, okay.
Mm-hmm.
So he says he drinks on average a gallon of
Water,
per
yeah.
day,
Per day, so you urination a lot. Always go to the bathroom, right?
probably.
Yeah.
Do you recommend he come here to get treatment and herbs?
It's very far, but you can try. I think we have the 消课丸 in our school. That actually is very good for diabetes. So supplement.
Okay.
Yeah, we have 消课丸. It's very good. I used a lot for the diabetes patient. It's very good result.
So Peter, if you're listening, you should come get a treatment here.
It's where he live. It's very far. I don't know.
Okay. So Kyushi asks, "Hi, Professor. Would you please explain more about Zhang and Fu and how do they influence diabetes?"
With TCM, we very, very concerned about Zhang and the Fu, right? Zhang is we have the lung, heart, and spleen, liver, and the kidney. Fu, that means Zhang we use the more stronger better. And the Fu, this means like large intestine, small intestine, the gallbladder and the bladder, some we need to reduce a lot. So this is two different. 脏是 yin 和负是 yang. Yang more work. 脏是 more like self energy. Yang reduce something, you know. This is fu more in the digestion we use a lot. But fu you can too much. 脏 we need much. It's the different.
A Chung asks, "Is there a cure for pre-diabetes through diet, good sleep, and minimize stress?"
Oh, this pre-diabetes, I think is the most time
This is a new question. Sorry.
new question.
Yeah.
Oh, okay. Yeah, pre-diabetes, some people say diabetes is not yet. I think it's if proper digestion, it's very good. And the less stress level less. It's help you a lot. Okay, no necessary take the pills, right?
Okay.
And there's some some Chinese the there's herbs. So I think make you stress level less, like 逍遥散 like 加味逍遥散 some happy that. And also happy digestion. We use lots of the 保和丸. I think it's lots of will help.
Oh, he's also asking if the first few slides are available for review. I'll go and put those up. Hope that helps. Okay. So Madeline asks, "Is it okay to eat simple sugar like sweet potatoes?"
Oh, sweet potato. Yeah, simple sugar sweet potato. But I think the less the better. It's not too much. Everything you want eat, just not too much. Okay.
Alright. So back to Judy's first question. So she's asking, this was the one asking if the patient who's been using insulin for a few years, she has type 2 diabetes. she's an older woman in her 60s who eventually used insulin. She has frequent urination and body pain.
Oh.
And so I guess her question would be, how can TCM help that?
Yeah, TCM, that like body pain, I think the acupuncture much better.
Acupuncture.
Yeah, acupuncture much better for stop pain
Mm-hmm.
and get the less painless.
And she can hear you too, so if you have any advice.
Oh, yeah. I think acupuncture is very good for less pain. Some people is because the blood circulation very slower, so make pain everywhere. So we can put the needle on the just like a few point, very important point. And the pain make the blood circulation very stronger, push the blood circulation, the pain will less. Yeah, so actually we treat a lot of patients that have diabetes for the pain manager and for like neuropathy some.
So Judy, I hope that helped you for your mother. Are there any other questions from you guys? Now's the time to ask the professor. Judy says thank you.
Oh, you're welcome.
All right, you guys, if there's any more questions, we have a few more minutes before the webinar is over, so please ask them. Okay. Peter asks, would Hong Chi and Tien Tuan Fen be used in conjunction with Western meds, Quanovia and metformin?
No. I think the way you use the West medication, I think this Huang Qi and the Tianhua Fen you can use same time. Yeah, it's okay.
And how do you treat thirst when the client doesn't want to drink water? Too much phlegm?
Oh, lots of phlegm, huh? Actually, we have the lots of point we can treat reduce the phlegm. Lung 7 and the stomach 40 for this phlegm and the spleen 9. And also we have lots of the herbs like 陈皮、半夏, okay, 瓜蒌. This all the relieve the phlegm, even Fuling some. It's weird. And we have lots the formula like 二陈汤, like 保和丸, like 清奇花坛丸. All the phlegm they basic on the 二陈汤, but this is also relieve the phlegm lot. It's good. It's very good.
What age range do we consider as middle age in TCM, Professor? I don't.
With the aging, what's that?
Age range, like how old you are?
Me? I'm old.
No. Okay,
Seven.
never mind. That's a weird question. What points reduce pain?
Oh, what? The point we are this is a point we always use the Hirsch point, like okay, GB34, stomach 36, and UB40, and some loop connecting point, because lots of dampness or heat inside, we use the loop connecting point, or we use the spring point. They will reduce. It's very good. If for heat, internal heat, we always use the spring point, like I think it's a lung 10, okay, heart 8, and spring 2, and the liver 2, and the kidney 2 also. It's the spin point is very good, reduce the heat and tonify internal deficiency, yin deficiency.
Okay. So H1 asks, what's the definition of diabetes, and is a blood test really needed to diagnose diabetes?
Yeah, from the ONC and the TCM, I think we just have the no lab test, right? We just depend the patient's symptoms. If the patient's like extra, like thirsty, always drink water, and then you look at the tongue and the pulse. The tongue, the patient drink a lot of water, the tongue is still very red and smaller, and this means you can consider the patients have the diabetes. Long time ago, we had with diabetes. We always think this shocker. This Chinese the TCM show is means always the patients even drink a lot and eat a lot, they still have very skinny, no gain weight. This is show. Ke is the means always thirsty, always thirsty.
Oh, okay. She says thanks. All right. All right. Thanks you guys so much for all your questions. I hope we've answered everyone's questions, and we will see you guys back here for the next webinar, TCM for dermatology. So thank you so much, Professor, for answering everyone's questions, and we'll see you guys
You're
later.
welcome. Thank you, everybody. You're welcome.